Good morning, everyone. Thank you very much for that kind introduction. It seems that one cannot get together at any sort of conference or gathering or workshop without there being a conceptual framework, if not one, perhaps 10 or even 20 or 30. Why bother having one for this type of gathering? Well, arguably one reason came out of our panel discussion earlier this morning, that if we're going to talk about breaking down the silos between agriculture, health, and nutrition, one way of doing so is to see holistically how all of these are meshed together. And in doing such an exercise, one of the things we see is that some of the links are, as yesterday's panels discussed, links between more food and impacts on health and nutrition. But the use of a framework actually gives us the opportunity to see many more links than exist. Also, too, in this morning's discussion, there was an element of it's clear what agriculture can do for health. It's not so clear that necessarily what health can do for agriculture. And yet, one of the things I would like you to take away from my discussion is the fact that agriculture, health, nutrition are tightly meshed and are all dependent on each other. If we're going to talk about a framework, it's important to recognize that frameworks and how they interact, different components interact, are going to be context-specific. And these contexts will include the physical environment in which people live, the social setting, the legal setting, the economic setting that they work within, and also the governance setting. These settings or these contexts provide opportunities, they provide constraints on the way different actors within the health and agricultural systems interact with each other and with themselves. If we take things down to the level of individuals and households, indeed, as a number of our speakers in the previous session indicated, this is in fact in some sense where we should put it first, the locus of attention. We can tell ourselves, well, these actors have a set of resources. These resources include assets of various types. They can include time. They include human capital in the form of schooling and knowledge. And they also include human capital in the form of health and nutrition. Now, you see on this slide that we use the word household resources here, but we put this in quotation marks to remind ourselves that ultimately many of these assets are held by both men and women. And understanding the gender and inter-household dimensions to the use of these assets is often important in the context of agriculture and health. Well, were I, and I am not, an agricultural economist, I would start off by saying, well, there is this broader environment or context within which people live and work. People have assets, they have time which they can allocate to different activities, plus they have knowledge, they have schooling. Clearly what they're going to do is they're going to combine these resources to produce agricultural goods, both crops and also livestock. Perhaps enough said. But in fact, the world immediately gets a little more complicated. While much of the discussion over the last day or so is focused on smallholders, not everyone in the world is a smallholder. Even in rural areas, there are many people who derive incomes from non-agricultural sources. And of course, in urban areas, people are reliant on other forms of income which they derive from combining these assets and time and knowledge. But what this omits is the fact that there is a direct link between health and nutrition on the production of agricultural goods and on income from other sources. The simplest way of describing this is to say that workers who are sick are not going to be productive. So therefore, if I am, and again I am not, a minister of agriculture, I should be genuinely concerned about the health and nutrition status of my population. Workers, for example, who suffer from malaria or schistosomiasis in areas where irrigation is very common, are not going to be as physically productive in the production of agricultural commodities as workers who do not suffer from those illnesses. Similarly, for those of you who have been engaged very heavily in issues around HIV/AIDS, a major source of concern in that debate, particularly in parts of sub-Saharan Africa, is what is the impact of that epidemic on agricultural production and on the productivity of workers. Similarly, nutritional status will also matter. Workers who are hungry, who have inadequate caloric intakes, are again not going to be as productive as workers who are healthy and well-fed. So before we move on from this slide, this gives us one very important core linkage linkages from health and nutrition to agriculture. Or to reiterate, if I'm a Minister of Agriculture, I really need to worry about these links from health to these other outcomes. We can also think of the generation of income that people take through agricultural production or elsewhere as going through the markets or value chains. We can think of this from the context of producers taking their goods to market. We can think of this from the context of consumers going to market to buy foods and other goods. Well, as people do this, they may decide to actually save some of their incomes and use these savings to build up or increase their stocks of assets, whether these be in the form of knowledge, the schooling of their children, or whether they be in the form of other types of assets. Alternatively, households and individuals may choose to consume the income that they've generated, to consume in the context of food, both of quantity, of quality, and also diversity of diet, in the purchase of goods which have a direct effect on health status, not only things like medicine and trips to the doctor, but also things, for example, by buying clothing, which is actually in some sense protective for health. And finally, they may buy other things on top of that. Now from this, we can see a link going through agricultural production to income generation, to goods, and on to health. But that link itself is partial. First of all, just as assets and time and knowledge can be used in agricultural production, they can also be used to affect health status of individuals. Think of, for example, the potential trade-offs between time spent in agricultural production, time spent looking after someone who is ill. Also, too, that there are direct links between agricultural production and health status. And it's important to bear in mind that, in fact, that not all of these links are benign. I suspect some of you in this room have actually done work within agriculture. And if your experience is anything like mine, physically, it is really, really hard. It is physically demanding. And the physical demands in themselves may be a cause of ill health. There's also considerable scope for people who work within agriculture to be subject to agricultural or workplace-related accidents, or which, for example, people working with threshing machinery, losing fingers, losing toes, losing arms. And finally, of course, working in agriculture exposes you to, for example, to zoonotic diseases. It may also expose you to chemical pesticides, which also have adverse health consequences. So there's a direct link between how agricultural production takes place and human health. In addition to all these links, of course, health is affected by the types and quantity and quality of the food you eat, and it's also affected by your nutritional status. Think, for example, about how vitamin A deficiencies will affect eyesight, will affect vulnerability to disease. And then finally, we can add to this list by bringing up back nutrition. We've already noted that nutritional status has a direct effect on agricultural production and income generation. Nutrition itself will obviously be affected by the quantities and quality and the diversity of people's diets. Nutritional status, too, is affected by the assets we have, our knowledge of how to combine those assets, and the time spent, for example, time spent by mothers feeding young children. And finally, we have the interactions itself between health and nutritional status. Now, when we get to this point in the presentation, we say to ourselves, there are an awful lot of arrows going back and forth across that diagram. And indeed, you might say to yourself, yes, I get it. These links are complex. But these links are not so complex that they're impossible to see. Particularly if we want to look at the pathways through which changes in agriculture affect health and nutrition, we see there are 6 such pathways. First of all, there's the one which has been discussed extensively, that changes in agriculture have a direct effect on changing households' ability to purchase goods that directly affect health and nutrition. Second, changes in agriculture change the types of goods which are available for households to consume. This can be, for example, through the introduction of new crops, such as the discussion of biofortification we had this morning. It can also come about through changes which are introduced through processing, such as some of the comments Dr. Branca made in the earlier presentation this morning. Changes in agriculture, particularly changes in agricultural technology, will change individuals' exposures to pesticides, to agricultural-associated diseases, and to work-related accidents. Fourth, changes in agriculture will affect the amount and the intensity of time which are allocated across agriculture, across health and nutrition. And here too, there may be very clear trade-offs. It's true, for example, we may be able to increase agriculture production by getting women to work more hours on family farms. But where, for example, that time is taken previously used for childcare, for example, to ensure an appropriate frequency of feeding of very young children, there is going to be a benefit in terms of agricultural production, but there may become a cost in terms of the nutritional status of children under the age of 2. We can also remember that there are going to be feedback effects, where, for example, agricultural growth takes place and where that leads to higher incomes. That may allow households to accumulate assets which have direct bearing on health and nutrition. So think, for example, about a smallholder who, say, for example, because of a series of good cotton harvests, is able to improve the quality of their housing and therefore protect their family, for example, during periods of poor weather. And finally, to emphasize again, although we speak of these things in this context in terms of households, households are made up of individuals, men and women. And these processes of changes within agriculture may have an effect on the changes of the allocation of resources within households, possibly to the benefit, possibly to the detriment of women and young children. So to summarize, we've talked a lot this morning, both myself and others, that agriculture matters to health and nutrition. But it's also important to remember that health and nutrition matter to agriculture. Third, that these links that go from agriculture to health and nutrition are often, but not always, beneficial. And so therefore the challenge to all of us, and indeed for all stakeholders in these areas, is to find ways that maximize these benefits while minimizing the risks. Thank you.